Good morning, everyone. I'd like to welcome you to the Cook County Public Health Human Services Board. I'd call this meeting to order at 8:30 on Tuesday, October 21st, 2025. First item on the agenda is that we go to staff here at this moment. So I'd move on to the approval of the consent agenda, which includes our meeting agenda, the minutes, financial report, abstracts and bills, and then the hire of Julie Kinney as our CADI/DD waiver case manager. Is there any item to be added to our agenda or anything to be pulled from the consent agenda, Commissioner Campbell?
Yeah, thank you, Mr. Chair. I'd like to pull item C, the financial report, please.
Thank you. Anything else from anyone? Commissioner Sullivan?
Mr. Chair, I'd like to make a motion to approve the consent agenda as amended.
Thank you. No motion support. Any further discussion? Hearing or saying none. All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. At this point, we can move on to, well, even though our new staff are not here, I'd still like to welcome them. And that's item number 2 here. We have Olivia Lander, Sarah Eisenreich, and Marina Fujimori. So thank you for either, well, I guess in all 3 cases, regional committee, is that right? Kind of, sort of? 2 out of 3? Okay. But much appreciated, and we greatly need the help and really appreciate the experience that's brought back, and thank you. Please.
Can I just add that I have heard just fabulous things about the new staff that have been hired, so I'm very excited and very thankful for the work that Plamen and the team have done to onboard the staff.
Thank you. And I guess before we get on to item number 4 here with the consultant report, I'd like to maybe talk about where we'd like to discuss the financial report. Should we do that under director's report? Seems most appropriate, but is that okay? So that's down the road here. Okay, that being said, we can move on to our consultant report, and I'll hand it over to Administrator Treble.
Thank you. So we have asked one of our consultants to present today, and so we have Meghan Mohs attending virtually. And so she will be walking us through what we refer to as a charter. It's basically our work plan with her. And so I don't think we can see Meghan yet, but can we hear you, Meghan? There you are.
There you are.
Excellent.
I'm here. Can you see me okay?
Yes.
Excellent.
Yes.
So Meghan, would you be willing to talk a little bit about your background and experience as it relates to your consulting work, and then walk us through the plan?
Absolutely, I'd be happy to do so. Thank you, Kristen. Well, good morning, everybody, and thank you for having me with you this morning to talk a little bit about the work I'm doing with PHHS, and which is just getting started. So my hope, as to Kristen's request, was to accomplish 3 things with you this morning during the time I'm with you. The first thing is for you to get to know me a little bit better. I recognize I'm probably a stranger to you, although I sat on the hiring committee for the director a little bit ago, so I had a chance to kind of virtually meet a couple of board members during that time. The second thing is to provide information about the work I'm going to be doing with, and I am doing with PHHS, by going through our project charter. And I did send a copy of the charter to Erica and just asked that it be put in the minutes, so that I'm going to be speaking off of the document today, but you'll have a copy of it as well. And the third thing would be just to offer time for any questions that you might have at this point, with the understanding that we're just kind of in the early stages of the project, so they're really, we can address questions about sort of the project and overall structure, but the conclusions and recommendations are a little bit in the future at this point. So just a little bit about my background, as Kristen had requested. I feel old saying this, but I do have over 25 years of experience in county human services, public health, behavioral health, and corrections. I have, I've been on my own as a consultant since 2016. I do have an educational background in social work and public administration, so I'm one of those few lucky people out there who's actually working in the area that I'm trained to work in, so I feel very lucky about that, especially in the current labor market. I do have, even though I was born and raised in the metro area, I do have experience both in the metro and greater Minnesota. So I started my career in county government working at AMC, and I worked for MAXA, the County Human Services Directors Association. After that, I worked for 9 years in Ramsey County in various areas. Adult Services Director, I was the Human Services Department head, and my final job that I worked at in the county, I had responsibility for both Human Services and Public Health, as well as 4 other county department areas. So since I've been consulting, I have worked in 2 interim director assignments, both of which were in greater Minnesota, where I served as interim director, and then at the end of my assignment, I did this sort of review that I'm going to be doing for Public Health and Human Services, where I just look through the whole agency and really talk about what's working and areas that I think you might want to focus on for improvement. So any questions about my background before I kind of dive into the actual charter and the project?
No, thank you.
Okay. All right, so speaking to the actual, work that has already started and will be going on in PHHS, I know that I'm aware you've had various leadership transitions, and so Kristen thought, and I agree, that it's a really good time to just, as I said, conduct an evaluation of the overall performance of PHHS. So, different from an investigation, this evaluation is going to focus on programmatically, fiscally, et cetera, things that are going well, as much as areas for improvement. So it's going to be a very practical final product and final report. And past counties, when I've delivered this to them, they've kind of gone through the report almost like a checklist of things that they need to address. So it will not be at the 10,000 foot level, it'll be at the ground level where you can actually action the things that I'm bringing forward to you. So Kristen Plamen and I have been working closely together. Let me scroll through here and get to the parts that'll be most relevant to you. So the project is going to involve engagement with community stakeholders outside the county, as well as decision makers such as yourself and stakeholders within the county. So yes, specifically in scope for this work is going to be program performance across PHHS, budgets, and I understand that's an ongoing area per your agenda this morning. We'll be taking a close look at that. I will also be looking at staffing and strategic planning across all areas of PHHS. So nothing is specifically out of scope, but I'm going to be focusing in most closely on the areas of highest risk to PHHS. And risk can have, as you know, a lot of different meanings, but just to give a few examples to make the concept come more alive for you is I'm going to be looking at if you're out of compliance in any areas that I can see, any operational issues, financial, there's reputational risk as well, of course, if things don't go smoothly, strategic, and any other risks I can find. So, and I'll also, per Kristen's request, I'll be looking at any areas where best practices can be adopted. And I'm aware you already have a consultant in place, Dave Lee, who's helping with your behavioral health area. I've known Dave for many, many years. He and I have both been county human services directors. Dave is highly respected in the field, so I'm delighted to hear you've brought him aboard. And he'll be focusing on the behavioral health areas at PHHS, and he and I will be working very closely together as I develop this report. Additionally, I did want to mention that, Dave is providing some program supervision for the behavioral health areas, and I will be doing a similar role to kind of fill in, helping with supervision in children and family services starting soon. So did want to mention that we're trying to, assist and support Plamen, and as he has a lot of things on his plate, and so that piece is going to be part of my work as well. So we started in early September, and the project is slated to end in February with a report delivery. So we've kind of done the initial kickoff, defining scope. I'm going to be, doing a bunch of just report and paper reviews of various reports from DHS and the health department, your community health assessment, your budget, work charts, all of these things. And then I'm going to be visiting the county the first week in December, and I will be meeting with a bunch of folks at that time and really have my boots on the ground there to see, directly from people and on site how things are going. And again, we'll be delivering a final report during the month of February. So I think that pretty much covers the charter that we put together for this project. And at this point, unless Kristen wants to add anything, I can certainly, again, stand for questions.
Megan, the one piece that I would add is when you are on site in December, I just want the committee to know that we will be working very soon on what that plan looks like, who you will be interviewing, and making sure that you're able to get as many interviews in as possible during that time.
Absolutely.
All right, thank you. Commissioner Gamble.
Yeah, thank you. Thank you for that background information, Commissioner Gamble. Can you give us a sort of an overview of your approach? It would be helpful. In other words, when you're stepping into role responsibility like this, typically, what is your approach in being able to dissect and take a look at the organization and then make recommendations? Just something quickly as an overview.
I'm having a little bit issue hearing, but I think the question was, what is my approach when I'm doing this type of work?
Yeah, a general overview of what your approach is, yep.
Okay, and I'm not sure, tell me if this answers your question or not, Commissioner, but I would describe my approach as candid but kind. So I definitely have a focus on building on things that are going well, but I tend to be fairly candid and direct in identifying the things that I'm finding that need to be changed. And definitely with a focus on, as I said, the highest risk areas that you might have. So I don't know if that responds to your question. Is there something further I could clarify, or does that give you an idea?
Well, that's, if you can hear or not, that's sort of an umbrella overall, but when somebody's, tasked with the responsibility of coming in and taking a look, it's sort of like trying to determine and discern where, I understand in the overview that you gave us, the idea of taking a look at the areas of greatest risk, and that is primarily, focusing on the things that brought us to this point. But when you're evaluating and you're doing interviews, so your methodology basically would be getting in there and not making any assumptions or anything, and your experience doesn't define anything, but you have a disciplined process that informs you so that you're in a position then to come back with recommendations. And so the interview process is huge, your approach so that you get people to be open, and kindness is important, but direct is because we need to get to the issues. And so that's basically what I was looking at, just understanding approach and style.
Absolutely. And I definitely have some, if this more directly answers your question, I definitely have some methodologies that I use. I look at comparison counties to kind of benchmark you as far as your case management, your caseload, your staffing, your caseload sizes, budget areas. So if that helps give a little bit of perspective as well, that is something that I typically look at.
Yeah, and I think it's hugely important coming with recommendation to understand the environment in which activity and performance is evaluated. And so if you take experience in being called in another county that has different caseloads, different circumstances, different challenges, the response wouldn't be applicable in our situation. So understanding uniqueness is hugely important. So thank you.
Absolutely. Absolutely. Thank you, Commissioner.
Commissioner Storley, please.
Yes, thank you. Good morning, Megan. I understand you were part of the group meeting with new applicants for the director position. Were you part of that?
Yes, I was part of the second round interview, I believe. I'm not
That's correct.
100% sure where it was in the process, but I believe it was the second round interview panel.
Do you have any thoughts on the availability and folks out there who have the background and the position of being a director for Health and Human Services? We went through lots of interviews and so forth for our administrator position, and that's a highly sought-out position with background that can be specific or can be, become specific with some training. But public health is a different thing because of taking care of people in the county in different areas. Do you have a feel for the possibilities out there for future applicants?
I can certainly give you my opinion based on what I'm seeing in other counties around the state. I think that Cook County, and I've shared this with Kristen and Plamen, I think that Cook County is not at all unique in being challenged to find somebody who has the right qualifications, and also importantly is a good fit with your county, with your county's culture, and as the other commissioner was saying, with the culture and the local values as well. I mean, I think that's critically important. What we're seeing in a lot of other smaller, more rural counties is that they are basically unable to find a director and are having to contract with another county or group of counties to share a director. I had shared with Kristen and Plamen some examples of different ways this can work from other counties around the state. And it's not to say that you necessarily will end up with that solution. You may be able to find somebody still. But just to, I did want to let Kristen and Plamen know, and I know Kristen was already aware, that this is something that's worked pretty effectively for some other smaller counties around the state, and it is an option if you're finding, as many other counties have, that it's just very difficult in the current labor market to find a qualified candidate that you can have confidence in.
Thank you. That's what I wanted, was your opinion on this. I'm hearing this when we go to other meetings with other counties, and so I appreciate your opinion on that.
Thank you.
Thank you, Commissioner.
Commissioner Sullivan, please.
Thank you, Mr. Chair. Meghan, one of the things you talked about in the time period that you'll be working with us up until February is that you'll be talking to community stakeholders. Specifically, what individuals or groups do you have in mind?
Mr. Chair and Commissioner, if it's okay, I'd like to kind of share this response with Kristen, as she and Plamen are kind of working up a list of folks that they want to make sure that I connect with. Kristen, do you want to jump in here?
Yes.
Or otherwise I can give a high-level opinion, but it might be more helpful for people to actually hear the individual organizations that you're wanting me to connect with.
Thank you, Meghan. So we have not yet developed the full list of organizations that we want to partner with and make sure are interviewed throughout this process. But Plamen and I will be working on that and working with Meghan on that as well. So we want to, hear from her who are the community organizations that she typically interviews in her role as consultant, and then knowing our community and culture here, who are the folks that we know we need to and want to partner with as well as we move forward. But at a high level, certainly this board would be one of them, our advisory boards as well, and then Grand Portage and several others.
Thank you so much.
Commissioner Gamble.
Yeah, thank you, Mr. Chair. Meghan,
Meghan.
Meghan, thank you. The discussion relative to partnering with other counties. I think when you're looking at your values overall, that it's most important that we fill that position to accomplish the objectives that are both mandated, required of us, and the level of service that we want to provide to our community. So when we identify those values in that context, I would say it's more important to be able to achieve what our objectives are, whether it is partnering or whether it is hiring. And I personally would rather see results-oriented decision as opposed to filling a position and having our own director. The other thing is when we're evaluating experience, ability, complementary giftings that a person brings to the position, that we're finding in today's marketplace that partnerships, especially for small counties, is highly attractive from a financial standpoint, and again, addressing what you're looking for in a position. I would rather fill a position with somebody that's competent, capable, well-respected, and if we can provide the level of service in that partnership, then I see that as being a great opportunity.
Great.
Yes, and I don't know, Mr. Chair and Commissioner, whether you wanted me to respond to that or there was a question there, but I do agree that certainly the financial benefits of sharing a director are one of the reasons why it is so attractive, and especially in a difficult labor market where it's just effectively not possible at times to hire somebody. I think one of the challenges that you may face in sharing a director, if you move in that direction, is making sure that you feel that your own staff and your own community has enough time and attention from that person who would be pulled in multiple directions to the extent that you need it locally. So there are, like anything, there are pros and cons to that approach.
Yeah.
Please go ahead.
Yeah, and as a follow-up to that, I was asking the question in the context of your experience as a consultant and what you have found, because a lot of things can look attractive, but then your lived experience tells you otherwise. So it's basically saying, and I would agree, there are pluses and minuses, and you need to evaluate them in the context of your own particular situation, but that's the context of what the question gets asked, your experience, whether that can be successful or not.
Oh, absolutely. I've worked with several multi-county groups recently in a different capacity with my consulting role, and they have the capacity to be very effective, and have been in various parts of the state.
Yeah, thank you.
Thank you, Megan. Any other questions? Doesn't look like it. All right. Well, thank you very much. Had the opportunity of meeting you earlier, but happy to see you again, and thank you for introducing yourself and speaking with our board, and look forward to working more with you in the future.
Likewise, thank you for the opportunity this morning.
Have a great day.
You too. Bye-bye.
Okay, that moves us down to item 5, Director's Report, and let's look at item C from our consent agenda, which is the financial report. And Commissioner Gamble, you had a question? Or?
Yeah, thank you, Mr. Chair. Yeah, the reason I want to have a discussion on it is I understand that the context in which we see this budget is not a scenario that makes things normal, we'll sort of say. Your attention and things have been focused on multiple things, and because of the staffing issues and changes and things that we're confronting, that this financial report might look differently, and that's just an assumption on my part. But when I look at it, and I see where we're at 3/4 of the year on this, if you just drop down to the bottom, it looks like on the expenditure side that we're just under 1% of 75% of budget, which is where we should really be at. So that's amazing, given what we've been dealing with. On the revenue side, we're at 19% below, and I'm just wondering if the focus on things that are taking our attention have kept us from the required filings in order to get revenue where we have revenue opportunity.
Yeah, I understand the question, and the short answer is no. The longer answer is we do receive revenue from the Department of Human Services, from the state and from the federal government based on quarterly reports we submit. So while we have the quarter end now, our expenditures have been incurred. We submit reports to DHS through our quarterly reports and through other entities for grants. Those examples are, again, DHS for the Mobile Crisis Response Grant, this Community Health Board for the work that the public health team does. And there is a delay in between the time we have the expenditures to when we receive the revenue. So in a month of October here, I've reported we've completed our quarterly reports on time this quarter. And I mean the fiscal team. So we will be receiving revenues in the month of October and November and December to offset these expenditures that we see. Similar scenario we're going to see in the month of January of next year, where we going to be reporting expenditures for the fourth quarter and have the time to receive revenue for year 2025 all the way through end of March of 2026. So we keep double books for 2 separate years for the first 3 months of the following year. Should I go into some amounts or is that going to be helpful? Yeah.
So Plamen, I have a question for you. With what you just said, is that 56%, is that typical to where we usually are this time of year? Okay.
Yeah, and as follow-up, thank you for that. We often hear when we're doing budget discussions that the Brady County Auditor Treasurer will tell us that certain funds, build whatever, come in at certain times. If we just look at the paperwork without that understanding, then these things can jump out as, and we wonder, is it okay? For the director within the department, financial director, whatever, when they have that understanding, just given the nature of the way things happen, and they explain that, then this puts us in a context that makes it healthy, as opposed to raising a flag and saying, how come we're at this point? In some cases, we have experienced in the past that because we aren't filing, we're missing opportunities for revenue, because for whatever reason. And so the oversight is simply making sure that as a director that we're in a position that you're entirely comfortable with knowing, how things operate and on the expense and the revenue side. So it just wanting to get that explanation to go along with what the figures are reflecting. So thank you.
Yeah, my team and I, we continue to look at every expenditure line and every revenue line to make sure that we understand where we're at every month. And one addition to that, we only have received one tax payment from the auditor's office so far this year. Typically we receive 3, and they're on schedule. We'll be receiving the second payment at about 50%, or slightly less than that, here in the month of October. And that will increase our revenues as well. But we are waiting on payments from Department of Human Services for the quarterly reports. We're also waiting on a payment from the DEED grant, over $80,000 for expenditures we've already incurred in 2025. The Mobile Crisis Response Grant from the DHS, nearly $80,000 too. So I'm comfortable with where we are sitting right now on our revenue side. I have no concerns.
All right. Mr. Chair, I appreciate the conversation. Thank you. And with that, I make a motion to accept the financial report as presented.
Thank you. We have a motion from Commissioner Gamble. Is there support?
Support.
Thank you, Commissioner Sullivan. Motion and support. Any further discussion? Hearing or saying none. All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. We'll move on in our director's report now to item A, staff updates.
Yeah, I'd like to take a moment to welcome our new staff. They are hard at work today. They were not able to join us, but I'll go into a little bit of each one of them. Olivia Bonander, Adult Home and Community-Based Services Supervisor, started last Monday. She's returning to the agency. Her previous 2 roles included in-home support coordinator and waiver case manager. She's hit the ground running. She is already looking at number of operational items related to the operations of her department and her team. And I'm very thankful to have someone with that energy level, experience, and willingness to tackle things right off the bat on our team. It's relieving some of my duties, which I highly appreciate too. I'm very thankful for her joining the team and coming with a lot of energy and experience. Sarah Eisenreich is, I'll explain a little bit down the director's report of her role, but she's currently as a temporary worker on the mobile crisis response. The intent is for Sarah to complete required trainings under the grant and to be the primary responder for our agency during business hours of 8 to 4, while the rest of the coverage is provided by the HDC, Human Development Center, who's recently changed their name. And that will be in the minutes, but I'm not able to provide that name right at this second, for which I apologize. Marina Fujimura is a recent graduate of University of Minnesota in Duluth. She is coming as an adult mental health worker. We did have short, but I think very productive period of time in which she overlapped with the previous worker, Lily Gruber-Schultz. I want to thank Lily for her work and for staying just a little bit longer to provide support for Marina and soft handoff with the clients that we are serving. I think that anytime we have a period in which the previous worker and the future worker work together for even a small period of time is a very valuable time spent. And so I'd like to welcome Marina. She's also already showing that she is energetic and working with clients, meeting clients one-on-one. She's working with under clinical supervision of Mr. Dave Lee, and I have connected Marina also with the adult mental health team from Cowlton County for additional support as things come up, and I'm also providing support on some logistical and other items as they come up from Marina. So welcome to all three of them. I feel like we're beyond a turning point. We are at a point where we are starting to rebuild our team and starting to look forward and be strategic versus being reactive. And I'm very encouraged by these recent hires and by the hire of Julie Kinney, who was on the consent agenda. Julie is also returning to the agency with over 10 years of experience in waiver case management. So we are starting to have teams where they're not depleted and not shorthanded. The only shortages we're currently experiencing are on the behavioral health team. The position for a supervisor has been posted. And the children and family services, where we have 2 workers currently. We are working actively to seek assistance from other counties for that team and from Meghan Mohs, who has experience on the children and family services area. With that, I think that will take care of the staffing reports. Kristen?
Do you mind if I would like to add one more thing, and that's that as we are filling these positions, Plamen and I are having conversations with Meghan Mohs and Dave Lee just to make sure that the positions that we're filling are high priority and make sense for the organization. So they have supported in the position in particular that I'm referring to as the behavioral health supervisor.
Commissioner Gamble.
Yeah, thank you. Thank you for that information. And that was a question that I had relative to looking at the organizational chart. Looked like we have 8 positions that are not filled around there. And having Meghan on board and David and yourself and working with Kristen, that evaluating and looking and coming with a recommendation as to how we fill those positions as opposed to filling the positions in the context of what was And that, I think, is a very important thing, and I think the community is looking at to say, how do we come out of this with an assessment that allows us to position ourselves to be fiscally responsible, responsive to our community as far as the level of service that we provide, and organizationally efficient. And so I appreciate the fact that we're taking a thoughtful approach and waiting for input from those that we've contracted with to help inform us in regard to how we fill positions moving forward, so we're not necessarily going to follow the same structure. Might be, but I appreciate the fact that it's being evaluated.
Did I see a hand over here, or no? Oh. Great, thank you.
Still continuing on the staffing, while we continue to search for the director, I should say, and different options. I had a conversation with Meghan, and I have agreed to serve as an interim director for the time that I am needed. So I think that's probably the most practical approach for now, until I was looking forward to hiring a director, but the first round of applicants, we were not able to find one, so I'll continue to serve as long as I'm needed, and I'll again provide support to the new director for the time period that's also needed and ongoing.
Thank you.
Please make sure you're also getting the support that you need during the 2 time in here. Thank you.
Thank your family.
Okay, we can move on to agency updates then.
Yeah, I'd like to start with a proclamation by Governor Waltz, designating October 22nd as the County and Tribal Financial Worker and Case Aide Day. Whereas county and tribal financial workers and case aides provide outstanding service to the people of Minnesota through their administration of public assistance programs, and whereas county and tribal financial workers and case aides are responsible for the prudent expenditure of millions of dollars annually and must meet high standards of job performance in determining eligibility for public assistance, the duties performed by the county and tribal financial workers and case aides require them to be well-versed in several areas to effectively provide services to clients and the public, and it's important to recognize the valuable services county and tribal financial workers and case aides provide for Minnesotans through a culturally responsive case management, accessible community services, and person-centered focus. Now, therefore, Governor Waltz of Minnesota hereby proclaims Wednesday, October 22nd, year 2025 as the County and Tribal Financial Worker and Case Aide Day. I want to take a moment and thank Dagmara and her team, Kristen Pedersen, Margaret Johnson, Andrea Cuthbert, Isabella Sheehan, Betsy Blaisdell, Leanne Avery, and Katie Page for all the work they do every day to provide services to our clients and community. Thank you. We're going to shift gears here now to a related topic, to the assistance programs. You are all aware, and the public, that we are currently under a government shutdown. And Dagmara is here to provide an update on the Supplemental Nutritional Assistance Program, as we have some updates to share with you and the community. We did publish a news release last week on that, but for those who have not had a chance to read that, the SNAP benefits for November may be endangered due to the government shutdown. So Dagmara is going to provide an update on what that looks like and what some of the measures we're taking to address that.
So we received information last Thursday that the U.S. Department of Agriculture, Food and Nutrition Services has announced that due to federal government shutdown, their will not be sufficient funds to pay for November SNAP and MFIP benefits. SNAP is a supplemental nutrition assistance program that provides food assistance for individuals and families. And MFIP is the Minnesota Family Investment Program that provides cash and food benefits for people with minor children. Why MFIP is tangled into this? It's because MFIP consists of the food portion, and at this time, the state does not have a solution to split this apart. It's like when we approve MFIP benefits, it's always approved as a package. So at this time, the MFIP program is also affected by this, but the state is looking into solutions, so hopefully there will be able to resolve this. What does this mean? This means for the households who currently are active on food support, they still receive their benefits for October and they are able to use them. But November's benefits are at risk and may be unavailable if the shutdown continues. For individuals and families that apply for benefits, they still may apply. We still accept applications. We gather verifications, complete interviews, and approve benefits. But they must be aware that those benefits might not be issued. And as soon as, we still encourage individuals to submit the application and get those cases ready. So hopefully when the government shutdown is resolved, they can receive their benefits. We pulled the report, just to give you some numbers and perspective, what does that mean for our community? We pull up a report for September. That's the October report is not available yet, of food support cases and MFIP cases in our county. So for food support, we have 212 people active on food support. That includes 138 adults and 74 children. And SNAP payments in September of 2025 amounted to $31,000. Now, if we're looking at MFIP program, we have 23 people active on this program, which includes 6 adults and 17 children. And MFIP payments issued in September amounted to $10,751. That's all what I have.
Thank you. Mr. Campbell?
Yeah. Thank you, Mr. Chair. Can you give for us, you gave the total amount of dollars for each, and you gave the total number of individuals. Can you give the range within each of those provisions, like for SNAP, the minimum and the maximum that an individual receives in each of those programs?
So with food support, the minimum amount that someone would receive, a household of one would receive, would be $23 per month. And maximum, I wish I had my, brought my computer, but the maximum amount for a household of one is $292. When we pull the reports of all different cases, the higher number we see is the numbers for families, where we can see somewhere between $700 and a little over $1,000 of a monthly benefit.
Okay.
All I wanted to add is we have a list of, we have generated a list and we are aware of the exact amounts, and we are ready with a plan as if needed to assist. But we're also hopeful that the federal government shutdown does not continue into November, as it's going to affect the SNAP benefits for the entire nation and not just the state of Minnesota. But we have no control over it, obviously.
Yeah. And Mr. Chair, as a follow-up to that, thank you for that information. I just, for the public to understand that the number of families or individuals that are affected by this provision and what that amount is puts things in context. If you look at the median amount of what that would be between the low and the high, the greater majority of individuals receive approximately this much. That says to the community that you've got this many individuals who are going to have this less amount of money to purchase food if, in fact, the shutdown continues. So,
Yeah, we are sure hopeful that in the next 2 weeks, everything will be resolved and we don't need to worry about those numbers.
Thank you, Dagmara.
Commissioner Scarlett.
Thank you, Chairman. So we aren't meeting until way into November. What kind of plans do you think will be helpful in the community, especially food-wise, if folks aren't able to, they can apply, but they aren't going to get anything, or not much?
We will continue to provide updates as they come from the Department of Human Services weekly, or as they become available. There is notice that is going out to all SNAP recipients today via USPS directly from the Department of Human Services, informing them of what could be coming. For us, in our news releases, we are including options for those clients. We are also able to support as needed. We have some availability of resources to support clients in need, but we also directed them to food shelves, to Ruby's Pantry, and other resources that we have shared in our news release.
We did briefly talk about this at our district meeting, and one of the things I just said is simply, grocery stores have their carts there, and folks can deposit something, or sometimes there's a theme, maybe this is the soup week or whatever,
yeah.
so we could up and help on that. Other than, like you say, you do have some extra resources that could be used depending upon how long this goes.
Yeah, those are our emergency funds and resources. So when we dip into them, that is something we'll be careful, but we will assist as needed.
Sure. Thank you.
And I would just add that those funds and resources will not cover the full amount past a certain amount of time. So those that can contribute and can donate, we really are encouraging the public to do that, to help the families that are potentially going to have this need.
Thank you. Commissioner Campbell?
yeah, thank you, Mr. Chair. Another point, has it been communicated as to, in some cases with the funding not being available, whether anything would be retroactive? In other words, if the community that participates in these benefits are being told that when the funding is provided at the federal level, that payments will be retroactive, or it'll just begin again.
We did not hear any of that.
Okay.
Yeah.
Okay. Thank you, Dagmara.
Thank you.
Any other agency updates you'd like to share?
I do have several updates from the public health team. So if you don't mind, I'm going to read through them here
Please.
now. Okay. Those are provided by Grace Kronager, a public health supervisor. I want to thank her for that, and the entire public health team for their work. The Resource Directory website project continues to be in planning phase. At this point, the cross-sector planning group, along with PHHS staff, is voting on potential names for the site. The billboard promoting 988 will be going up in November. This is part of the Giant campaign funded entirely by the Mobile Crisis Response Grant. Calls to 988 that screen into the mobile crisis response are routed to our local staff during business hours and after hours to HDC. Again, they have changed their name. Improving awareness to 988 is a strategy to also drive utilization for our local mobile crisis response service. Welcome Bike to School Day on October the 8th was a success with around 30 local participants. Our fall and winter preparedness campaign underway and will run through mid-November. Community members are encouraged to post about their preparedness efforts and or to call public health to let the team know about individual preparedness efforts for entry into a raffle to win a pre-made preparedness kit donated by Paramount Planning. This project is a collaboration with emergency management in both Cook County and Grand Portage, as well as the local businesses, Clearview General Store, Grand Portage Trading Post, and Joins, Ben Franklin, and the Grand Marais Public Library. These are all places where you can pick up a preparedness checklist. Grace Granager, Public Health Supervisor, attended the State Community Health Services Advisory Committee meeting in Brooklyn Park on October 8th and 9th. The topic of this meeting was tribal and county public health system and collaboration. Andrea Orest, Harm Reduction and Prevention Specialist, and Rocio Rivers, Youth Prevention Specialist, attended the Prevention Program Sharing Conference in Duluth on October 14th and 15th, along with local Prevention Coalition member Kim Nelson. And Andrea is part of the session of the development of the regional Speaking of Cannabis campaign in collaboration with our Regional Community Health Board. This campaign focuses on providing parents and caregivers tools to talk with the young people in their lives about cannabis and its effects on a developing brain. Local Prevention Coalition member Larry Dean wrote an article for Substance Misuse Prevention Plan. There is a link that we're going to include with the minutes. The coalition also partnered with the Grand Marais Public Library to create a display of books related to substance misuse prevention. The Regional Board to Health survey continues to be circulated locally to a randomly selected, the Regional Bridge to Health survey continues to be circulated locally to a randomly selected group of households. Grace was on WTAP to talk about the survey and its uses since the paper survey hits mailboxes last week. Andrea Ores says that the name for HDC is Bridgewater Health. So we'll correct that in the minutes.
Brightwater.
She
said Bridge?
Bridgewater.
TBD.
I apologize, it is Brightwater.
Oh, okay.
Yeah. Okay. Christina Matson, ship coordinator, updated a brochure providing local food support resources that is available through the department and to the community at large. In addition to SNAP, the WIC program is also impacted by the federal shutdown if it continues into November. MDH-based staff are looking at what the impacts might be and how to mitigate the impacts for participants. WIC participants are receiving direct messages from MDH through the WIC app as the situation evolves. Rocio Rivers, Youth Prevention Specialist, will be at the ISD 1666 and GES weekly to provide support to middle school-aged youth by connecting them to community resources and facilitating conversations about prevention topics. She is also working with two pre-existing youth groups in both Grand Portage and the LGBTQI plus youth group in Grand Marais to provide prevention resources and supports. Here's the update on Sarah's work. The mobile crisis response pilot continues. Sarah Eisenreich and Melissa Wickwire are both in their roles as the temporary employees with PHHS, funded through the Mobile Crisis Response Grant. Andrea Ores continues to serve as the lead responder project lead, with Sarah expected to have completed trainings and ready to engage in response efforts by the beginning of November. The draft needs assessment from the University of Wisconsin Superior for the Mobile Crisis Response Project will be available by the November PHHS board meeting for review. There is a Northeast Minnesota age-friendly regional event on November 3rd in Chisholm. Grace will be speaking on the panel to represent the age-friendly community engagement project conducted in 2023-2024 in Cook County, as well as subsequent action planning efforts. A draft action plan will be available by November PHHS board meeting for review. I want to, if I may, close in on with a couple comments. We have been going through a lot of transition in our department, but I want to make sure that the commissioners, the community, and everyone else understands that our department and team is working very hard in many aspects and many areas and continues to provide a top quality service to our clients and community. And I want to thank every single one of our staff members for the hard work they've been doing under difficult and challenging circumstances. So, thank you.
Thank you, Plamen. Any questions for Plamen? Looks like not. Thank you again. No items for board action today. Moves us down to our committee reports, which I inaccurately predicted to not have time for. So now we have.
Who would have known?
Yeah,
You were
never
just setting
know.
us up so we wouldn't be disappointed.
So we can start on those, and we do have plenty of time. So the first one is the Active Living Steering Committee, Commissioner White.
Well, unfortunately, and I do need to still speak with Christina and Rowan, but it was in my calendar. You know, you accept it and it goes straight into your calendar. The start time was 11 o'clock in my calendar, and it was actually 9 o'clock.
Oh.
So I only got the last 15 minutes, which was very disappointing. But, so I don't have a complete description of what happened then. But, you want me to continue on to the next one?
Please, yeah, Arrowhead Economic Opportunity Agency.
Yes, I traveled down the road to Arrowhead Economic Opportunity Agency, and though they are struggling in some aspects with their funding because of the feds, they are still great community support. They are building, or in the process, it's a multi-year process, of building a homeless shelter, not for one person, but for a number of people. They've also just retired, and now I don't remember anybody's name.
Oh, Scott, so, or,
Yeah, Scott just retired. It is a well-functioning, and it seems as though, because there are many employee reports, that the people that work in that agency really care about community, not only inside the agency, but outside the agency. So it's pretty hopeful for the world. And then, now it's Gary's turn.
well, the next
Oh,
one
no,
is
Arrowhead.
Arrowhead Health Alliance, yeah.
Yes, there was, that I did not go, I did go down to Duluth, but I did attend, I zoomed in on that one. And there was not a lot of new things happening at all. The new contract for the building and all that had been taken care of months ago, and they're just moving along. They were discussing, at one point, the review of the director job performance and making certain that his compensation aligns with across the region. So,
It's very nice. We have the Zoom option, or the app.
yeah, like I can't, yeah.
Yeah. Thank you. Next one is Arrowhead Regional Corrections, Commissioner Gamble.
Thank you. Commissioner White and I attend those meetings. This meeting was held following our district meeting, and so they rescheduled at 1 o'clock, and we met in the Government Center in Duluth. The primary bulk of the discussion was a closed session relative to union negotiations. And so how they approached that and considerations to be made relative to the bargaining groups. I think there's 12 of them. And the link, of course, with Arrowhead Corrections is basically, as Commissioner Nelson from St. Louis said, I feel like I'm bargaining with myself because it is St. Louis County really that ends up picking up this bill, and then it's covered in part through the distribution of what we pay as participating counties. So that was the bulk of the conversation. I was privileged to be part of the evaluation of the executive director, Becky, and in my first term as commissioner, I had the privilege of being on the personnel committee and interviewing her for a position in one of the three operations under Arrowhead Corrections, and it has been a real joy. That was a term that was used often in the evaluation to see her progress, the respect, and I was basically, I used the term blown away by the staff and their evaluation of her. And so when you see somebody, we've all probably had experiences in life where we bump into somebody and then we see them later in life and we see how far they've come because of who they are and what they contribute. So it was a very, very positive review. She does an excellent job. And we're looking at new ways as far as setting challenges for her moving forward, new ways that we can market AOC because they do such an excellent job in their relational approach to trying to reduce recidivism amongst offenders, and the other is continuing to cultivate our relationship with the tribes within the Arrowhead region, which we've made great progress on and appreciate that partnership. So it was a good meeting because the time was consumed with the union negotiation overview. The reports were very brief, and it happened fast, but it's always a good meeting.
Thank you. Next one is the Child Care Solutions Subcommittee, Commissioner Storley.
We've not met.
Okay, thank you. The next one's Community Health Board. We had our meeting yesterday. Our directors out on medical, and a very short, well, relatively short meeting for that board. But my normal highlight is with our medical advisor or doctor, and it was on the bird flu, avian flu, H5N1, and just gave a little overview of that. I requested also West Nile to be put on that. I've been hearing more about that, but the reason he picked bird flu was just because it's been in the news a fair amount again, and he just wanted to learn more about that and share what he learned, and took just a few notes. I guess there's been 900 cases globally in humans, 50% of which were in Egypt in 2024 and 2025. And there's been 1 death in the U.S. So the fear is when avian flu comes to mammals and then can then also come to humans. And there are stockpiles of vaccines, but it's being saved for if there is a pandemic there. So I thought that was pretty interesting. Most of the contractions with humans are with farm workers, and it is an airborne virus. So just good to be aware and keep things in perspective there. And at this point, it doesn't seem like a very impending threat, but we want to be prepared for if that mutation happens. It sounds like Finland is the only country in the world that does offer a vaccination for it currently, even though there are stockpiles globally. So, yep. And we also had our personnel committee before that meeting, talking about just the labor market and FML or paid family medical leave. And how that's going to affect, staff or not, and just what those costs would be. So we're going to be deciding more on that in December. That moves us on to the Cook County Local Advisory Council for Mental Health. Rana.
Okay, we talked, I think all of the newly hired people were there, and we got mainly just met them and they talked, and it was very helpful to do that and good to see them, and it was a very, very, very good meeting.
And I'd like to add to that. Grace was talking about the 988 number, and that it is not just for people who are suicidal. There was the discussion that there are many lonely people that people just need to talk about, somebody to talk out their problems with. Like the day is just really going poorly, they have no one else. Do call 988. I mean, that is what, and so as the conversation evolved, where is a place in this county for those people that are indeed pretty isolated or alone? It's the hub that there, and that is indeed a place where people just come. No money is necessary. You don't have to buy anything. It's a large enough space. It can accommodate a small group or a large group or whatever. But that was something the Council on Aging had met the week before, but that was a perfect spot for people to congregate and not feel out of place. So, yeah.
Thank you.
And I especially appreciate just that the emphasis that 988 does not have to be for suicide.
Right.
It's for.
And I actually was unaware of that. I just thought when it gets really bad.
Right.
But no,
Thank you for bringing that up. Much appreciated. Let's see here, restorative justice, Commissioner Gamble.
Yes, thank you, Mr. Chair. So we went over caseload, which is typically what we do, how things are going, and opportunities that we have to work with victims and perpetrators and get them talking to each other to try to reconcile. And it's a healthy approach that doesn't take a punitive approach, but seeks to help both the perpetrator and the victim understand each other and the effect of the offense. A lot of those tend to be related to altercations or shoplifting, and so we go over caseload. The other thing is that the grant monies that we had talked about, $300,000, that the restorative justice is taking the initiative to begin a not-for-profit, and so they are soliciting board members, and they are putting together articles of incorporation and bylaws in anticipation of submitting that so that they get the not-for-profit status. The advisory committee will still advise that board, but that direction is something that they feel that they will do that will help them better serve their objectives when it comes to restorative justice. So.
That's big news. Thank you. Council on Aging, Commissioner White. You
back
touched
to
on
me.
that. Yeah. Touched on
Okay,
that.
well, when we met last week, or week before, there was discussion about finances, of course, really hoping, I mean, they got, perhaps we'll be getting $35,000 from the county, but they are really not scrambling at this point, and they have a healthy bottom line in CDs, those things, but they are definitely hoping that that they could become a line item for the services or for the space that they provide. And in light of what I said about 988 and people being lonely, some of the situations that have occurred at the hub just this summer have been where somebody comes in, and this was one particular person, I have no, male, but I have no idea anything else, but for a number of days, just to have a warm place to be during the day. And then what? And I do know that it was discussed that people have come in or on occasion where their check hasn't come in yet, but they would like to have a meal, and there's absolutely, they get a meal, and as a rule, the people return when they get paid and they come back in. The price for a meal has been raised to $5 now instead of $4.50. It has gone up incrementally, but it's now $5, and that's because AEOA, they just have to raise it. That's all there is to it. So, yeah, so that's another, and then I noticed when I was there at the meeting that there were indeed new people that locals, I couldn't think of their names, but they were just gathering and having cups of coffee in different spots, and so that was a good thing about it. It's a very highly active, involved, committed group of board members.
Thank you. Emergency Preparedness Committee, Commissioner Sullivan.
Thank you, Mr. Chair. I would like to jump back to Council on Aging and just remind the public that during the month of November, in honor of Veterans Day, that the Cook County Council of Aging will be providing meals to veterans throughout the month. And this is being sponsored by Auxiliary 413, and veterans just need to call in and let them know what day they're going to have a meal. Maybe it's multiple days, and just let them know their branch of service. We are tracking that. And so we look forward to many veterans being able to come to the hub and not only have their meal in honor of Veterans Day, but also to make sure that they're connecting with others in our community. So just a little plug for that. For emergency preparedness, Plamen shared information from Grace, but we are promoting emergency preparedness, not the go bags that I'm well known for during the summer for fire, but in looking at winter preparedness and making sure that whether it be in your home, in your vehicle, in general for your family, that you have all the materials that you need. So there's lots of information that will be going out through social media. Plamen mentioned all the local organizations that are supporting this as well. But I would really encourage people to submit their checklists, join in the raffle, because you get a great bucket from Paramount Planning of all kinds of emergency gear. I would love to be able to get that. I'm not going to participate because I already have my amazing go bag for all seasons, but I really encourage our public to get involved, and it's a way to, again, help your family and be prepared for what we know will come at some point. Commissioner White.
And I'm assuming there are at least 2 or 3 chocolate bars in that bucket.
Certainly in my equipment, there are many more than 3. That's for sure. Thank you.
Thank you. Healthcare Planning Committee, Commissioner Storley.
We've not met.
Any update from NACO?
We are meeting
Yeah.
lots.
Yeah.
About every 3 days, I'm getting an update, and so I just have to wait and see what's going to happen nationally. We do have by Friday some selective areas that we've been voting on, so I'll make sure I get that submitted by Friday and just wait and see what happens.
Thank you. Let's see, Northeast Minnesota Office of Job Training, Commissioner Gamble.
Meet tomorrow.
North Shore Collaborative did not meet. And then we have our Advisory Council. Frank's not here today. Anything you can share with us, Commissioner Gamble?
I don't believe we met.
Okay.
Yeah, we haven't met for successive months now.
Okay. And the Cook County Food Access Council did meet and talked about food shelf and the super shelf planning, and just a lot of the collaboration that's happening. Also, snacks and packs, and then there's been some collaboration between the Northwest Food Project, Farmers Market, and the food shelf, trying to bolster that with produce that was not sold at the farmer's market, and bringing that to the food shelf. So just really impressed with our community's collaboration and cooperation, and really trying to think outside the box as far as what can we do and to help those that really need it. Commissioner Shirley.
Yes, could you give us an idea about the capacity at the food shelf, which is at the Congregational Church, I believe, and what the impact would be if we all start bringing a lot of supplies? Do you have any idea on that?
I don't have perspective on operations and where they're at in that remodel, or the best way to, because the best way to get resources there,
Right.
because I don't think you're going to want to do it just one-offs. But I can ask more specifically and maybe get some clear
Donna Lunkey, I think, is working on
guidance.
that. Yeah.
Yeah, there's a team, but yeah, Donna Lunke might be great to reach out to. There was an email thread that I can pull up here to see if there was any other contact points there.
And Mr. Chair, while you're looking that up, just a reminder for everybody here that the Association of Minnesota Counties is asking for us to report how we are helping our community potentially get through this crisis with food. And so ideas that we have, things that we see on social media, things that we are aware are successful, they would like a report from that so they can share out to other counties and spread the wealth, spread the ideas.
And this email thread was just about scheduling. It wasn't about any of that progress there. So thank you, Commissioner Sullivan.
Sure.
But I'll certainly get back on what the best path is and where the capacity is. Last one is for the good of the order. Anything that we haven't covered someone would like to share? Mr. Gamble?
Yeah, I'm sure we all share this sentiment, if you want to refer to it that, but it's much more. But whenever we experience something that is challenging, and as we have in public health, human services, that it can take your emotions, it can take your thinking, your thought process, your conversations with constituents, different directions, and things that are challenging are called and termed that because they are that. And so as a board, I'm sure that we all express our deep appreciation for those that have held in there and have persist doing your jobs in the midst of the weightiness of things that are challenging. And I would also say that in Rena Rogers, in her intern position, being willing to tackle this when she in fact did not have to, has served this community well. And with Kristen coming in, anytime somebody steps into a new position, you're always looking forward to everything, and then you find out what reality is in some areas, and it can be a bit overbearing, but that is simply to say that the term community means that within the circle of the people that bear the responsibility, that there's deep appreciation for the willingness to tackle this. In our individual lives, we are confronted with things that are disheartening, and people come alongside, and as a community, we want to come alongside the department and look at what we can gain out of this experience that makes us better and more effective at what we do. So thank you to all the people and your staff that are stepping up to the plate and trying to make us better.
Thank you, Commissioner Gamble. With nothing else, we're at our last item, which is adjournment. So we're adjourned. Thank you.
To the way and forgot.
Well, at least you didn't throw it away, throw it away.
Yeah.
Okay, good. Okay,
I'm starting to
good,
think.
excellent.
It's like,
8 hours
when we got
yesterday
it,
running
when,
drains and
I
trying to
remember our
find
governor
clogs
gave
and
us all
minerals and
a rebate.
So you
check,
wanna-
you know,
tools off